Hi, and thank you for joining me. My name is Tanya, and I am the Holistic Health Practitioner here at Critical Bench. And today in this video, I want to talk with you a little bit about Alzheimer's therapy and activities. So when I was doing some background work and research for this video, there's lots out there. I mean, I could make a million videos and probably never even come close to covering all that's out there. And there's a lot of new stuff that is coming up that's very exciting and is going to give a lot of people out there a lot of hope when it comes to Alzheimer's. So when I was looking into, therapies and activities, I found sort of a combination of what a lot of doctors like to recommend to patients and loved ones who are looking after family members that are diagnosed with Alzheimer's, that they refer to as like therapy activities. So they're things that can be done with the person who has Alzheimer's that is not necessarily, a doctor or medical therapy itself, but they're things that can be done to help hopefully slow progression, or at least keep the person with Alzheimer's engaged and giving them more lucid moments, more good days than not so good days. And the main focus really was all on brain health. So again, I'm going to go back to, a couple other videos when I talked about this, how sometimes it seems almost as if, and I'm guilty of it too, that it seems that once something happens, once we're told some bad news, or we hear something that concerns us when it comes to our health and our mortality, we all of a sudden start looking into everything we can do to be healthier, to be better, to live better. Now, I do believe that most of us, if not all of us, really are getting up in the morning and doing our very best to live the very best life that we can. And that, by, being good people and taking very good care of our bodies and taking very good care of our families and our brains and looking after ourselves and looking after the people we care about. So I'm going to stress another point again here, because in reading the research that I had access to, there was so much out there about brain health and the things that we can be doing right now, the things that you can be doing right now to just support really great brain health. And it doesn't mean that it's 100% cure-all, or that it's going to prevent you from ever getting sick or prevent you from ever getting Alzheimer's or dementia. But the more good that you do for your brain, for your body, the greater your chances are, right? So why not do them? So again, having said all that, when it comes to therapy activities, a lot of it is stuff that can be done right at home and just in the community. And I found some really great things out. So a few little activities that a person diagnosed with Alzheimer's can do that you can encourage them to do to just get those parts of the brain engaged, to keep them working and functioning, talking to each other, is something as simple as brushing your teeth with your non-dominant hand. Okay, it forces your brain to use another side of itself to do a common, regular, everyday activity that most of us don't even think about it. I know myself, I'm usually half asleep while I'm still brushing my teeth. But that's just something very simple that, and make it fun. Make it fun for them. Make it a little game. Another one is getting dressed with, like putting clothes on with your eyes closed, or simple tasks like that. Now, nothing dangerous, nothing like driving with your eyes closed or going for walks with your eyes closed or even doing laundry with your eyes closed, but things like, getting dressed, that, in the safety of a safe environment with somebody there, to get the brain focused on not so much looking and taking in the visual, but the act of doing it, thinking what do they have to do to put on a shirt, put on pants, all right? And again, you can make it, as silly as these sound, they do seem to have a positive impact, and you can make it fun. You can turn it into a game and make it fun. Another one is encouraging the person with Alzheimer's to, if you can, to wear earplugs. So they have to experience their environment without sound. So again, they're taking in the visual, but it's not being combined with, it's not like part of the package of visual and audio. It's just visual, and so their brain is taking in the visual without the help of sound to determine what's going on in the environment, what things are, so that their brain has to interpret the stimulus that they're seeing. strictly all up in here without, that's a dog barking. Just that's a dog and its mouth is moving, so it's probably barking. All right. And again, make it fun, make it a game so they don't feel, I mean, these are all things that if probably done, I don't want to say done incorrectly, but how they're presented to somebody can possibly make them feel like they're being belittled. It could make them feel silly and small, and that's absolutely the last thing that any of us would want to do. But you can make it fun. Do it with them. Put in earplugs too. Make it a game somehow, and just, you know, do what you can with these things because they do seem to help. Another one was when I first read it too, it had me a little confused, and that was taking clocks and pictures and just turning them upside down. And when I first read that, I thought, well, that just seems kind of mean. But when I did a little further reading, again, it was forcing the brain to flip it in, like inside itself. So while you're thinking, you know, you look at a clock, and if we see a clock on a wall, 12's at the top and 6 is at the bottom. So if I take that clock and I turn it upside down and I bring a loved one into the room with me and they see that, it's challenging their brain to make it right. Okay, so if all of a sudden they see that the 12's on the bottom, their brain is going to want to flip that to interpret that information correctly the way they know how. Now, I'm not saying that this is 100% that they're going to walk in and go, well, how come your clocks are all upside down? They may not notice, but these are all little things that present stimulus in the outside world to somebody with Alzheimer's in a very different way that's going to challenge their brain to make it right, to correct it. And that's keeping the brain active, keeping those brain cells talking to each other and processing information, okay? Another one is trying to get the person involved in a new hobby. You know, get them to do something new that they've never done, and something that requires some focus, where, you know, they do have to actively use their brain to focus on a task to complete it. Now, they may not sit down and you know, knit for 6 hours. They may not finish a scarf in a day. They may not build an entire ship in a bottle. But if you can get, I don't know, 15, 20 minutes, a half an hour, you never know. They may love it so much that they just may sit down and just do it. I think some of that has to do with what their personality was like before being diagnosed. But get them learning something new, because learning something new requires your brain to take in new information it's not used to. And it has to make sense of it. And it's making active use of that part of the brain that does exactly that, like learning a new language or learning to play an instrument. That part of the brain that is used to do those things is key in helping with the onset and the progression of Alzheimer's. It can help delay early onset, and it can help slow progression down, because it's forcing that area of the brain and those cells in that area to talk, to communicate, to process information. Some other things that when doing the research and reading through different journals and reports and studies that were done, a few other things that I just want to add to this are, like, you know, baking and cooking, because that requires measuring. It requires paying attention. Now, depending on the level of advancement or the stage that somebody is experiencing Alzheimer's, you do not want to leave them alone. Be there with them. Again, make this fun. Be a part of it with them and engage them, because also that engagement with another person is also very key and vital to keeping that brain active and processing information like conversation and emotion. If the person that has been diagnosed with Alzheimer's was very much like a clean freak and really like to organize things, keep them active in that, you know. Take them out to the garage, or if you got a room in the house, a spare room or a basement or something that you've been meaning to get to for a long time, to clean it out and organize it, ask them to help you. Chances are, if they were that kind of person before having Alzheimer's, their brain is going to can probably very quickly get back into that zone and you know, help you out with that, and it's good for them. It's good for them. It's good for them that we encourage them and support them and to keep doing the things that they did like, as well as encouraging new things. Again, things like music, puzzles, reading, anything really that is engaging their brain, okay? Exercise and nutrition are always incredibly very important, as, you know, not necessarily a prescribed therapy, but they are things that we can do, that we are in control of, that can support really great health, and particularly brain health when we're talking about Alzheimer's. So there you go. When it comes to therapy and activities, those are some things that you can actually do at home with someone that you love, someone that you're looking after who has Alzheimer's, and try to make it fun for them. You know, try to make it a game and be a part of it with them. I want to thank you for watching this video, and if you did like it, please give it a thumbs up and please share it with friends and family. If you haven't done so already, please subscribe to our channel. We have got lots of great videos on this channel. There's something here for everybody, and lots more videos on this topic. Again, my name is Tanya, and I'm the holistic health practitioner here at Critical Bench, wishing you a very happy and a very healthy day.